What happened to getting back to normal? It seems like every month, every 2 months, there's a new normal. So what's our new normal going to look like this coming fall semester? I'd like to talk about two different things. First, I'd like to spend some time getting to know our enemy, learning what we're up against, the Delta variant. And then I'd like to talk about hope. The Delta variant is the one that was first identified in India, then spread to much of the world, including the United States, and now makes up over 80% of new cases in our country. There's no question that Delta variant is going to be the dominant virus on our campus this coming fall semester, so it's worth knowing what we're up against. To help us learn a little bit about the Delta variant, I put together a number crunching exercise. Don't worry, I did all the work ahead of time. You just need to sit back and relax. So say we have one person who gets infected with a virus. That one person gives it to one other person, and that new person gives it to one other person. And say we do that 9 rounds of transmission, one person giving it to another and another 9 times. How many people are sick? 10 people. Pretty simple math. Now I'm going to make one small change. Instead of passing to one person, every person who gets sick passes it to 2 other people. So a person is infected with the virus, they give it to 2 other people. Each of those 2 people gives it to 2 more people, so we have 1 person, 2 people, 4 people, so on and so forth. Again, 9 rounds of transmission, same number of times of transmission. How many people are sick now? 20 people, 40 people? Turns out, just by making that one small change in the number that each person gets infected, now we're at about 1,000 people sick. So now let's do that again, and instead of 2 people, we'll do 4 people. So one person gets sick with the virus, they pass it to 4 more people. Each of those passes it to 4 more people, so now we have 1, 4, 16, and so on and so forth. Still, again, only 9 rounds of transmission. Now we have almost 350,000 people who are sick with the virus. We're going to do it one more time. Instead of 4 people, we're going to double again and do 8 people. So somebody gets sick with a virus, they pass it to 8 more people. Each of those passes it to 8 more people. So we have 1, 8, 64. Again, only 9 rounds of transmission. And now we're up to about 150 million sick people. To ground this in our experience, what we were dealing with last fall, the original sort of COVID-19, was the 2 to 3 person scenario. Then last spring, the Alpha variant from the UK kind of took over by the end of the semester, and that's when we were dealing with more of the 4 people scenario. The CDC puts the R0, or the replication number, for the Delta variant somewhere between 5 and 9.5. And on a college campus, when we're all interacting together a ton, we're probably towards the higher end of that range. So this coming fall, this is the scenario that we're dealing with. What I love about this visual is that it's not that the data for the first 3 scenarios isn't there anymore. It's disappeared because it's an entirely different scale of contagiousness. In terms of immunity, we're starting to see some concerning data, especially coming out of Israel, that 4, 5, 6 months after vaccine, our immunity starts to wane. And of course, that's also true for the immunity we gained from being infected in the past. The good news is our vaccines are still remarkably effective 4, 5, 6 months out at preventing hospitalization and death, over 90% effective. In terms of severity, we don't have enough data yet to conclusively say whether or not Delta variant results in more severe infection. There is some concerning data. We're just not there yet to make that call conclusively. Our treatments still work really well against the Delta variant, so that's more good news. It's that bottom bullet that really has us worried. So there are parts in the United States with lower vaccination rates. There are a number of countries around the world where less than 5% of their population is vaccinated. There's a number of countries with less than 1% of their population vaccinated, which means that Delta variant is spreading like crazy with that high replication number, and it's mutating really quickly. A team of scientists in the UK put a report together for Prime Minister Boris Johnson and health officials, and they identified some likely scenarios or some possible scenarios as we look forward to the future in terms of mutation of the Delta variant. Situation one, in terms of immunity. The scientists said it is almost certain that the Delta variant is going to mutate to better evade the immunity we get from vaccines and through prior infection. Almost certain. In terms of severity, there's a lot of room to grow. The scientists said it is a realistic possibility that the Delta variant mutates to become more lethal. It could possibly become 10 to 20 times more lethal. That's more on the extreme end. But like I said, there's a lot of room to grow. In terms of treatment, the scientists said it is a likely scenario that the Delta variant mutates so that our treatments work less well when people have serious infection. So that last bullet, the mutations, is what we're really worried about. All of these are possibilities. They're probabilities. They're not certainties. So I think the takeaway is that we can expect things to change more. That's just our reality. So what do we do with that? When we start to think about some of this, it can feel kind of dismal. It can potentially start to feel kind of hopeless. So that's why the next thing I would like to talk about is hope. What are our sources of hope for this coming fall semester? Number one on my list is our community. Having a strong and well community. Because we don't know what's going to happen. If things don't go well with the Delta variant, we don't get to just fall apart and tear each other down for political beliefs or vaccination status. We have to remain strong and well as a community no matter what comes our way. That means getting together and dialoguing and being willing to work with people with different perspectives and collaborate as we solve challenging problems and innovate into the future. That means seeing each other with empathy and understanding that different people in our community have different needs and that it's worth working and going the extra mile to meet those needs because we gain so much when all of our community members are well and present, be that in person or virtually. It means being willing to do small, inconvenient things like wearing face masks to keep our community well. Again, because we gain so much when our community is well. We have to remember that the health of all of us depends on the health of each of us, and just importantly, the health of each of us depends on the health of all of us. Next on the list is our vaccines. Our vaccines are safe. They are remarkably effective at preventing hospitalization and death, and they're still really good at preventing infection and symptomatic infection. Every vaccination matters. If you're thinking, oh, what's one less vaccine? It's not going to make a difference. It will. When we think about a virus that can spread from one person to 8 more people, and from each of those to 8 more people, and spread so fast, every time we cut that chain of transmission, that's a big win for our community. Every vaccine matters. Ideally, people are coming to campus already vaccinated with that immunity, but if that's not your reality, it will be plenty easy to get a vaccine once you get to campus. The last thing on my list is experience. We've done this. We've got this. We've already been through a year and a half of really hard times. When we stop to think about what we've learned and how we've adapted over the course of the last year and a half, it is truly awe-inspiring. We've learned so much, and we're going to be putting that knowledge, whether it be about COVID, whether it be how to manage our community and be well as a community during these difficult times. We've learned so much, and we're going to use that knowledge in the fall, and we're going to learn more things this coming fall that's going to help us move into the future and, again, be well. So, as we come back to campus this fall semester, my hope is that we can come vaccinated, we can come ready to collaborate and empathize with each other and work together so that we can be strong and well as a community, no matter what comes our way, in a spirit of love and honor.